Okay, everyone, it's 12:03. We're going to get started. So thank you, everyone, for joining. My name is Adrienne Esposito. I'm the Executive Director here at Citizens Campaign for the Environment, and we'd like to welcome you to our Lunch and Learn presentation on PFAS chemicals in our drinking water. I'm joined today by two wonderful people. I'm joined today by Dr. Kyla Bennett. Dr. Kyla Bennett is the Director of Science Policy for PEER, which is the Public Employees for Environmental Responsibility organization based out of Washington, D.C. I'm also joined by Miriam Rotkin-Elman. Miriam is the Senior Scientist and Toxic Director for the wonderful organization NRDC. Both of these women are experts in this field, so we're very excited to have them today to be able to present to you. So let's begin. We're here today to talk about PFAS in our drinking water. So we're going to begin sharing our screen, and there will be time for questions and answers. So please hold those questions, and we're going to go through this material. Jordan, can you share the screen? Okay, there we go. Next slide. Okay, so why are we having a lunch and learn about this? Excellent question. You should know, or you may not know, but some of you do, because I've looked at the list of who's participating. In 2020, New York State did establish the strongest drinking water standards anywhere in the nation, actually, for the two chemicals called PFOA and PFAS. So PFOA and PFOS. This drinking water standard, after much debate and much discussion, was established at 10 ppt, parts per trillion. Parts per trillion is a very low standard of measurement, and that's a reflection of just how serious these chemicals are and just how we should not be exposed to them. This year, in 2022, New York State is expanding their regulations. There was legislation passed in order to mandate that this be done. And they're going to be looking at another 23 different chemicals. Recently, only about maybe a month ago, or yes, about a month ago, the New York State Department of Health came out with a proposed, it's not yet legislated, it's not yet codified into law, but a proposed drinking water standard for 4 more of those chemicals. I'm not going to go over the alphabet soup, but you can see them in front of you. Those are the 4 chemicals. They are also in the category of PFAS. And they propose that each of them also have a drinking water standard of 10 parts per trillion. They also proposed that New York State create a cumulative standard. What does that mean? That means that they propose that if you've lost the drinking water lottery, I should say, and you have a long list of these chemicals in your drinking water, you cannot have more than 30 parts per trillion of any of them in a cumulative way. So that's what that means. And that is another proposed standard. And then they'll be coming out with some required testing and notification for another 19 of the PFAS chemicals. So where does that leave us? Next slide. Okay, we are right now, and this is why we're having this lunch and learn right now. We're in the middle of a public comment period with the New York State Department of Health. They're asking for the public's opinion on what they have proposed. CCE, as well as a number of other organizations around New York State, have the position that now we have actually even more science, which both Kyla and Miriam will talk about, that tells us that even though the 10 parts per trillion was created just a few brief years ago, we now know there's more science that tells us even that is not safe. So we have been asking for the health department to update the existing regulation we have for PFOA and PFOS. We do not feel that 10 ppt is any longer adequate to protect public health. nor do we agree with the 30 cumulative standard of PPT that has been proposed. As Dr. Bennett will tell you, there's other states already across the nation, including Maine, Massachusetts, and Vermont, that have a cumulative standard of 20. Why would people in Massachusetts get more protection than the people in New York? We don't believe they should. Our position is to reduce the drinking water standards as close to zero as possible and to set a combined standard that is as low as possible as well. We're going to hear more about that, but I just want to bring up a QR code on the screen for all of you. This QR code will bring you to a 2-page fact sheet that CCE has created. It'll tell you a little bit of information about PFAS, but also on the second page, it will tell you who to write to and some letter writing tips on this issue. We need for the public to participate and write to the New York State Department of Health about getting these drinking water standards down to the lowest level that we can and to making them be the most protective we can for New York City residents. So I'd like to introduce our first speaker, Dr. Kyla Bennett. Dr. Bennett, the floor is all yours. The Zoom floor is all yours.
Thank you so much. Let me just pull up my presentation here. And okay, can everyone see that?
Yeah, it's perfect.
Great. Okay, so today I'm going to talk to you a little bit about the dangers of PFAS in drinking water and why you should comment on the proposal by the Department of Health. So let's start with the basics. What are PFAS? PFAS is an acronym for per and polyfluoroalkyl substances. It's a mouthful. The chemistry is very, very complicated, and it's a huge class of chemical compounds, thousands of substances, and we'll get into that in a few minutes. The couple things that these compounds all have in common. First of all, they all have a carbon-fluorine backbone. This is carbon atom with a fluorine atom that are bonded together. This is one of the most strong chemical bonds known to humans, almost impossible to break, which is why they are very persistent and nicknamed forever chemicals. They can take decades to hundreds of years to break down naturally. Many of these PFAS chemicals are also bioaccumulative. In other words, they can move up the food chain. And all that we have tested have levels of toxicity that are of concern. Why are they even here? They were developed in the 1940s. They are used as water and stain repellents and surfactants. They are found in almost everybody's blood serum, and it is a national crisis. You can find PFAS even today in carpets, carpet cleaning products, food packaging, especially things like microwave popcorn bags or fast food wrappers, on upholstered furniture, in cosmetics, in your outdoor gear like your sails for sailboats, tents, backpacks, in your rain gear, in adhesives and sealants, protective coatings that you spray to waterproof your shoes, for example, all that nonstick cookware, baby car seats, which is extremely concerning, firefighting foam, and even firefighting turnout gear. PEER has found PFAS in artificial turf and in pesticides, which means that PFAS are literally being sprayed on us from the air and the ground everywhere. It's a disaster. There are 3 routes of exposure for PFAS. You can ingest it either through food or water. You can inhale it. When you try to burn PFAS, it doesn't really break down. It gets into the air, it can travel up to 150 kilometers and you can breathe it. Or if it's in dry soil during a drought, you can inhale it that way when it gets into the dust. And also you can absorb it through your skin. That's why we're seeing so many firefighters with cancer, because their turnout gear has PFAS in it and they're absorbing it into their skin. Why is it dangerous? And what does it do to you? We're still learning about all the awful things that PFAS can do to humans and to other wildlife as well, but some of them are here. Increased cholesterol, increased risk of diabetes. They're hormone disruptors. They can reduce fetal growth. risk of childhood obesity, developmental issues, increase in thyroid disease, increase in preeclampsia in pregnant women, which is very concerning, and increased cancer risk, particularly testicular cancer and kidney cancer. And now we're starting to see some links with brain cancer. Very, very scary. So why do the states need to step in? Why does New York and all these other states, why do they have to do something about PFAS? It's because EPA is not going to save us anytime soon. EPA released its PFAS strategic roadmap under the Biden administration at the end of 2021. It was eerily similar to the PFAS action plan that came out under the Trump administration in 2019. In the Biden plan, there was nothing of substance except for a promise to regulate two PFAS, PFOA and PFOS, in drinking water. The plan relies very heavily on voluntary stewardship and uses what we call the whack-a-mole approach to regulation, regulating one chemical at a time. Now, remember, there are thousands. If we keep regulating one at a time, we're talking about thousands of years before we can regulate all of them. What's wrong with voluntary stewardship? Well, you often hear people say, oh, well, the US has banned PFOA and PFOS. This is not true. What happened is in 2006, EPA entered into a voluntary stewardship program with 8 of the major manufacturers of PFOA and PFOS, and they asked them politely to stop manufacturing it. They agreed, but they did not agree to stop importing it or to stop using it. So we are still finding PFOA and PFOS, theoretically 2 of the most dangerous PFAS out there. We're finding them everywhere, everywhere. Why are we finding them everywhere? Well, one of the reasons, Chemours is one of the companies that makes PFAS and uses them. This is an actual billboard where they say, let's change the formula. And that's what happens. Every time a state starts to regulate one of these thousands of PFAS chemicals, these companies will just tweak the chemical formula just a bit and come out with a new one. The problem with this is twofold. First of all, they're never safer. We haven't, in fact, Gen X, which is one of the replacement PFAS for PFOA, seems like it might be even more dangerous than PFOA. And second, these things will change. They can recombine under treatment in wastewater treatment plants. And I'm going to talk about that in a few minutes. And the terminal end products of that chemical reaction are PFOA and PFOS. So in other words, you can have a PFAS chemical that's not PFOA, but once it breaks down a little bit, it will turn into PFOA. So right now, there's a huge fight at the federal level and among the states over how we define PFAS. EPA has this very complicated definition, which basically, when you translate it into English, means that any chemical that has 2 adjacent carbons, one of which is fully fluorinated with fluorine atoms, and the other at least partially fluorinated. The states are taking a much more broad approach and an easier definition. They're saying any substance that contains at least one fully fluorinated carbon should be considered a PFAS. Why is the definition so very important? You can't regulate what you can't define. So when you're looking at EPA's definition, what is being excluded here? Is something being excluded on purpose? Is EPA defining PFAS so narrowly so that they can keep certain pesticides, for example, to be legal or certain coolants? We don't know. We have a lack of toxicity information on the vast majority of PFAS, and this is incredibly disturbing. But the different definitions lead to vastly different numbers of PFAS. So, for example, EPA's national testing strategy says there are 6,504 PFAS, but EPA's own CompTox database says there are 12,034. Which is it? Are there 6,000 or are there twice as many 12,000? Some research papers say there are as many as 1 million. Again, if we can't define it, we can't regulate it. How many PFAS does EPA currently regulate in drinking water? None. Common misconception that EPA is regulating them. They are about to, but they haven't yet. So why are the states right to use such a broad PFAS definition? We must use the precautionary principle. And for those of you who don't know what that means, it simply means that we need to adopt precautionary measures when scientific evidence about an environmental or human health hazard is uncertain and the stakes are high. These are carcinogens. The stakes are very high. EPA just in June of 2022 issued new interim health advisories for PFOA and PFOS. And as Adrian suggested, for PFOA, it's 4 parts per quadrillion, tiny, tiny amounts. And for PFOS, 20 parts per quadrillion. They have to issue these new draft regulatory limits by the end of this calendar year. So by December 31st, in a little more than a month, their draft will come out. The final rule will be in 2023. Are they going to be this low in the parts per quadrillion? They will not. And the reason they will not is that we can't even measure that low. We are not physically capable of measuring PFAS in the parts per quadrillion. Currently, states like New York and Massachusetts regulate PFAS in parts per trillion. And just so you can understand the difference between the two, 1 part per quadrillion is 1/1000th of a part per trillion. So they're orders of magnitude different. So what EPA is saying basically in June of 2022, when they said 4 parts per quadrillion and 20 parts per quadrillion, is that there's virtually no safe level of these two PFAS. So why is EPA slow walking this? I highly urge you to go look at Sharon Lerner's series of articles in The Intercept. She had a 10-part series about how EPA is captured by industry. They are not speeding this up. They are slowing it down. Another good example of how far behind EPA is on this, in 2019, under the Trump administration, EPA stated it had a map of all the facilities in the US that may be handling PFAS. They never released it. We did a FOIA. They wouldn't give it to us. We sued. We won, and we got the data in July of 2021. EPA has still not made that map. We made it for them. These are the facilities that may be handling PFAS. And in New York, there you go. And this is a vast underestimate. We have over 120,000 sites that may be handling PFAS in the country. This is a vast underestimate. What are we underestimating? Every single fire department. As I said earlier, turnout gear has massive amounts of PFAS. Every time the firefighters wash this gear, which they do at the fire stations, because it takes a special type of washing machine, that water is chock full of PFAS, and it goes out into the groundwater or into a wastewater treatment plant, which is a problem, contaminating drinking water everywhere. This is a handy little graphic of the PFAS cycle. And the reason I put this up here is to show how difficult it is, how this is just all going into a circle. We can't do anything with it. We can't figure out how to destroy PFAS. So when we throw stuff out, if you throw out an old rain jacket or your old pan, it goes into a landfill, it rains, the PFAS comes off, gets into the leachate. The leachate goes to a wastewater treatment plant. And one of the most interesting things we've found recently is that the amount of PFAS in the influent, in other words, the stuff going into the wastewater treatment plant, is lower than the stuff coming out of the wastewater treatment plant. So more PFAS are actually being created in the treatment process of the wastewater treatment plant. We can't burn it. If you try to burn it, it just gets into the air, travels 150 kilometers, lands. So it's this constant cycle. The only way to get rid of PFAS is to turn off the tap. So the states are trying to fill that void that EPA is not, that EPA has left. This is a map from Safer States that show all the different states, obviously on the two coasts mostly. And New York is trying to do some things, which is great, but their current proposal is not strong enough. What is New York doing? They set in 2020 maximum contaminant levels of 10 parts per trillion each of PFOA and PFOS. We now know that that's way too high. They do regulate PFOA and PFOS as hazardous substances, which is great, but not enough. And in October of 2022, New York announced that it's going to set these new maximum contaminant levels for 4 additional PFAS and requiring testing and reporting for 19 more. But as Adrian said, 30 parts per trillion for PFAS 6 is not enough. Massachusetts and other states have 20, and that's not enough. What else does New York need to do? They need to ban the use of PFAS-contaminated biosolids. Remember when I said that wastewater treatment plants have all of this PFAS in their water coming out? Well, what they do with that sludge is they dry it and sell it as fertilizer, and people spread that all over their farms, and this gets into our food. We have to ban the use of all PFAS contaminated biosolids, and all biosolids have PFAS. They have to ban the use of PFAS in turnout gear. They have to ban PFAS in all non-essential consumer products. You don't need PFAS in your mascara. You don't need PFAS on your couch. Is it a convenience? Sure. Is it worth getting cancer for? Absolutely not. They also need do not eat advisories for the fish and the deer that are chock full of this PFAS. PFAS must be regulated as a class. New York and other states have to stop regulating these one by one by one. There are far too many. They all share that strong carbon-fluorine bond, and therefore they're all persistent. Many are bioaccumulative, many are toxic, and one by one will take thousands of years. PFAS in drinking water is only part of the problem. Yes, we're drinking it, but we're bathing in it, in our bathtubs and our showers. We're wearing it in our clothes. We're inhaling it from dust, and we're eating it in our food. We must minimize the risk and turn off the tap. I always liken PFAS contamination to a bathtub that's overflowing. Right now, EPA in the States have a bathtub like this, and they're emptying it with a teaspoon, but that tap is continuing to flow. We have to turn off the tap, get rid of PFAS in all non-essential uses, and that's the only way that we're going to save ourselves and the environment. And that's it. Thank you very much. Adrienne, you're on mute.
Yeah, sorry. You'd think after 4 years of this, I would get it. Thank you very much, Dr. Bennett. That was a lot of information. I'm feeling a little depressed, but Miriam, tell us, what can we do? What about New York? Where do we go from here? Turning it over to you.
Hey, well, let's get this going. Great to be here. Really appreciate the chance to talk with you all. And thanks, Dr. Bennett. That was a wonderful overview. And PFAS is regularly one of the contaminants that I feel, it puts us back. We feel intimidated, and then we need to get started, right? What are we going to do about this? So we're going to talk about PFAS drinking water standards in New York and where we are. And as I'm Miriam Rotkin-Ellman, and I'm with the Natural Resources Defense Council. Make sure I can advance. Okay, so as Dr. Bennett said, there's a lot of contamination. This is a map that was published earlier this year of known and suspected PFAS contamination. And I mean, you all know where we are, New York, we've got a huge problem. And when you have contaminated drinking water, it's a major source of exposure. Dr. Bennett talked about there being multiple routes of exposure, and that's important to note because it helps us figure out what we do about it. But where we have contaminated drinking water, we know that is a substantial part. You can match the levels in drinking water to the levels in people's bodies. When it goes up, you have higher levels in people's bodies. When it goes down, you see lower levels. We know this is a major source, and it's a source that we can control. Drinking water standards, those are enforceable regulations that are either issued by the federal government or the state government, set those levels. Public water systems cannot deliver you water that is contaminated at levels that are above standards. That's what standards are for, and that's why they're so important. They also set levels for cleanup. When you've got a contaminated site and you need to know how low do we go, that's where you get drinking water standards. That's where they're important. And often that is where pushback happens, not only from the people who need to clean up the drinking water, which are our water purveyors, but also from the folks who contaminated that water in the first place, because they're on the hook. And so standards are an incredibly important tool for protecting public health from contaminants in drinking water. And it's why we're all here and why this is so important. The federal government sets drinking water standards, and states can set drinking water standards. You can't have anything above what the federal government sets, but states can set them below. And as Dr. Bennett said, states are leading the way because we don't have federal drinking water standards. And that is critical for where we're going to go as a nation. But as we are in New York, states can lead, states can set the bar and can get us started in getting us drinking water protections. Dr. Bennett went through this, but I have a couple different additionals to why we're talking about no safe level. So as the science has gone here, the allowable amount, what scientists think is a good amount of PFAS to have in drinking water keeps getting lower and lower and lower. So these are all other numbers. So California has really low levels. Scientists are looking at different health endpoints. There's cancer, there's harm to the immune system. That harm to the immune system is actually reducing children's vaccine responsiveness. That means that the same vaccine, if the child has a high level of PFAS in their body, is not as effective. We just lived through, or are hoping still through, a global pandemic. We know how important it is for kids to have functioning immune systems for us to move forward as a society. That just in a couple years, EPA's own health advisories drastically lowered. And then the other thing that's super important, and you can pull it from what we've been talking about today, is that while drinking water is an important route for exposure, we're being exposed to PFAS many different times. Alphabet soup, PFOA, PFOS, PFNA, I could keep going and going. And it's not just drinking water. It's coming through the dust in our homes. It's in the air. We can't afford to have high levels in our water. We have other levels that are uncontrolled, and we have an opportunity to control it in drinking water. And that's why we're looking at as close to zero as possible. And that's why we don't want to be messing around with each of these individuals all the time. We want to get as close, as low as possible for as many PFAS as possible, because we want no PFAS drinking water exposure. Okay, so here we are. That's the context. Here we are in New York. Okay, so we got to start with the good stuff, right? Because this is important. Not every state is doing it. So what is DOH is doing some important things, and when we tell them that we need something better, we start with what's good. Okay, they are testing. Good to have. Good comprehensive testing is important. They are starting to set maximum contaminant levels. Maximum contaminant levels is that standard, that enforceable standard. And notification levels, that gives people alerts to levels that are, MCLs are where we need, because those are the enforceable. Notification levels help people take protections when they don't have MCLs. They're also starting to address multiple PFAS. So getting out of the one at a time. Those are important first steps. Okay, what needs to be fixed? So first of all, the levels are too high. We just had a lot of conversation about how what we need, these health advisories, these are way below 1. We had, in a couple of years, EPA's health advisory went from 70 to less than 1. More science we have, the more dangerous these chemicals are, the more we need to get to no PFAS in drinking water. So we need the high, the levels that DOH is already spotlighting. We need those levels at the detection limit being the lowest amount that you can detect. And that's as close to zero as we can get with our technology. They're not the MCLs that DOH is putting out aren't comprehensive enough. We need to capture all the different PFAS that we know are problematic, that we know are showing up in water. DOH is not relying on best technology. They're not relying on the best technology for testing, which we know we can get down to this 2 parts per trillion consistently. And they're also not getting us to the treatment technologies that we know exist that can clean up drinking water. Where does that leave DOH? And this is the message that they need to hear, which is that they're not in line with the science, and they're not in line with other states. And as a result, they're leaving New Yorkers not protected. Okay. Whenever we're talking to an agency and we're asking for more protections, we need the why. Why is this so important? We heard a lot of it already. I'm just trying to capture that in a New York context. PFAS are extremely dangerous. Scientists use the terminology of PFAS crisis, right? This is a crisis because they are toxic at extremely low levels. They are very, serious disease. We're talking about lifelong harm. We're talking about cancer. We're talking about very, very high levels of disease. In communities where there's contaminated drinking water, there are high levels of disease. We cannot allow that to continue, and we need cleanup. The current standards, some New York folks have estimated, are not going to protect 500,000 New Yorkers. It's unacceptable. And probably even more when we have more testing. That's a low level. And we need to ask for better leadership from our health department and from the governor. We need them to be looking at the best science available, the best technology available, and pushing forward for protections that get us to what is needed to prevent the harm that we know is happening. I think I'm going to stop because we have some time for questions.
Great, thank you so much. I just want to bring up, Jordan, can you just bring up that QR code again for folks? So people can go and use this QR code to make their public comments. You can see there who to write to. You can have, there's some letter writing tips as well. And then there's just on the front page, there's a lot of facts about PFAS. So this is just done to make this process easy and doable, because everybody's voice matters. And this is our chance. This is our chance to weigh in with New York State Department of Health and say, we want this drinking water standard as low as possible. And we don't want a cumulative standard of 30. That is way too high. And as Miriam said, it's not protective enough to at least protect at least 500,000 New Yorkers. So these are things that we can do by using our voice and writing a letter that really will add to the protection of public health. Okay, Jordan, you can take the Q code off. And we got lots of questions in the chat. We're going to answer some of them. Let me just go up to the top here. Okay, Beth is asking, are there certain types of neighborhoods that have people with higher levels of PFAS in their systems? Urban neighborhoods, disadvantaged, farming communities. Dr. Bennett, do you know about that?
Yes, there are. Firefighters are one community that have, I think it was estimated they're anywhere between 9 and 14% more likely to get cancer, and they do have higher PFAS in their blood serum. Farmers who are on conventional farms, probably because of both the biosolids. Now, remember, organic farms are not allowed to use biosolids. So conventional farmers are exposed through the biosolids and also through pesticides. And also fence line communities. It is a huge EJ issue. And also if you want to Google or your favorite web search, Cape Fear down in North Carolina, around the plants where they manufacture things with PFAS. So those fence line communities are highly contaminated. So there are differences around the country.
And the other thing is where there's contamination. So so you need to, it depends on where your water is from. So right, so New York City's water isn't in New York City, thankfully, but it also doesn't mean that it's not contaminated, right, from the sources around it. And that's why drinking water standards are so important, because they both set the limit for what can come out of your tap, but also for the cleanup levels that help protect this, what's called source water. So where looking at this is why both Dr. Bennett and I put up those maps, right? Because we know around where there's contaminated sites, there's contaminated drinking water. And those are the places we need to make sure are getting really good testing and really good cleanup.
And I want to say, I see a lot of the participants are also from Long Island. On Long Island, actually, there's not really a pattern. I mean, it's an equal opportunity offender for groundwater to be impacted by a lot of these emerging contaminants, including PFAS. So there are some areas around old Navy sites, like in Carrollton. There's some areas around military sites. They definitely have PFAS contamination. And then there's other areas where there's been industrial pollution, but it doesn't follow a pattern of economics. It follows a pattern of previous land use. Okay, we're going to move on to other questions here in the chat because they're piling on now. Is PFAS higher on Long Island compared to elsewhere? I would say one of the problems with Long Island is that we have the sole source aquifer. So once the PFAS is put into the groundwater system, it can't go away because, as was said earlier, it is classified as the forever chemical. It doesn't degrade. It doesn't have a biological breakdown process. So that is of concern. But there are other areas around New York State and the nation where they have excessively high PFAS content, depending on, again, what industry was there and military sites and other issues. Will you send us the recording? Yes, the recording will be sent out to the participants and we're going to post it on YouTube. We have a YouTube channel, which actually gets a fair amount of traction. Actually, we did another program recently with Dr. Bennett on artificial turf, and that's been really getting a lot of views. Okay, is anyone in New York looking at biosolid application legislation? Not to the best of my knowledge. I'll ask Miriam if she knows, but we monitor legislation on that. And I know Brian Smith is on here with CCE. He monitors all of the bills. If he knows of some, he could just chime in. Miriam, do you know of any?
I know people are worried about it and thinking about it and trying to figure out what is the right way to do, how to do that, because right now the treatment, the wastewater technology results in PFAS contaminated biosolids, and we're going to keep having biosolids. So figuring out what to do with the biosolids and how to treat them is actually a significant problem. And Maine has there's a really good example in the state of Maine in terms of banning, because they had such a big problem. So I know right now people are looking at, where do we need the protection the most urgent? You know what I mean? Like, can we set spaces off? Can we contain it? You know, what are the spaces to do? But I don't know of existing legislation, but a lot of folks are worried about it and trying to figure out what to do.
As far as I know, Maine is the only state that currently has biosolids regulation. And part of the reason is they've had some heartbreaking stories up there of farmers who basically had to abandon their farms. And what they're doing is they have a limit for the amount of PFAS that can be in biosolids that can be land applied, but also they have a fund to help those farmers who have lost their farms. And what they're thinking about doing is putting solar panels on them, because you can't grow food on them, because it's going to be, the soil is contaminated. Once it's contaminated, you're out of luck for a long, long time. You should not be farming on that site.
And Patty Wood has a comment in the chat here saying that she's going to work on bringing back the fertilizer legislation, which we all worked on a couple of years ago now. I don't know how the time goes so quickly, but that's legislation that limits or prohibits the high nitrogen and from being used in fertilizer, which is a big issue here on Long Island since we seem very addicted to our green lawns. And the legislation also talked about water soluble and organic fertilizer as well. Okay. So another comment is that Maine is really leading the way. Yes. Okay. So to round up here, somebody else had to put in a late one. Here. None of the regulations affect people with private wells. That is very true, Terry. Local departments of health don't send information for private well owners. That's true, because they don't test your well unless you request it. So, and this is a big problem. I know on Long Island, there's 40 to 45,000 homeowners who have private wells, some of which live right next to the Navy plume in Calverton that have PFAS contamination. And actually, I'll be with them on Wednesday. We'll be doing a big press conference. This is saying there should be money to help support. Couldn't agree more. 100%. There should be funds that test private wells. I couldn't agree with that more. Thank you for writing that comment.
There was also a question about getting your blood tested.
Well, actually,
if you want to answer that.
yeah, I actually would like to answer it next year, and you'll be hearing more about this. It's fascinating, actually. Yale was provided a grant, a federal grant, from the National Institute of Health, and has asked Citizens Campaign for the Environment to partner on that grant. And we're going to be asking for your blood. This is the first time we've asked for that. We normally ask you to write a letter. We normally ask you to sign a petition. We ask you for donations, but we've never asked you for your blood before. But starting next year, the goal is to have 500 people on Long Island provide blood samples that will then be tested for a whole suite of PFAS chemicals. So it'll be the first of its kind done on Long Island. So you'll hear more about that next year. But there's nothing that I know of to date so far, unless, Kyla?
Yeah, just one point. There are blood tests available, especially for people who, like firefighters or people, Department of Defense people who have been exposed, communities that have been exposed. But one thing I just wanted to flag is that currently the test that the government suggests you use for your blood will only test linear PFAS chemicals, not the branched ones. So you need to be very careful about if you are going to get your blood tested, and there are several labs that do it now. You can actually get it through Quest Diagnostics, but I think you either need to pay out of pocket or get a doctor to order it for you. But make sure that you're getting the test that measures both linear and branched. Otherwise, you're only going to be looking at a fraction of the PFAS in your blood.
Okay, there's a question in the chat from Beth Fatini. Why is New York State resistant? And I don't want to present to you that they are. In fact, we should acknowledge that New York State, I see both Carla and Miriam shaking their head, yes, has really been a leader on this. I mean, we do have the strongest drinking water standard in the nation so far at 10 parts per trillion. And New York State has really worked hard on this. It is complicated science. We are limited by some technology. As Dr. Bennett said, we can't test down to parts per quadrillion like we would like to. So there are some technology limits. And I think New York State is not resistant. I think they have some, struggles that they're struggling with technologically and with policy. But I think the more they hear from the public, the better standard we're going to get. And that's exactly why we're doing this.
The other issue. Oh, I'm sorry, Miriam, go ahead.
I was going to say, I think this is a really great place for public to weigh in. What I hear when I look at the New York State's documents and some of their presentations is focusing on what they can't do instead of focusing on what they can. So they're very focused on, oh, well, I'm not sure, is the detection limit here? Is the detection limit here? Sometimes the labs are here. There's a lot of data that you can get down to 2 ppt. That is what others, you know what I mean? Like, we know that happens, that's what we can do. And that's what the public can say. Like, we want you to do what we know we can do, and we need to do it now. And instead of, sort of it's like, oh, if you set that there, then the labs will meet it and we'll move forward with what we need to do. And the same thing for the combine. I mean, ultimately, as Dr. Bennett said, one at a time, even groups of 6 is not going to get us to thousands and thousands of chemicals. There is an option, and the federal government has it, and so does the state of New York. It's going to take them a little bit of time. We get these individual standards now, and then what we get is what's called a treatment standard. And that means that you're using the tech, you're not relying on having to test for thousands and thousands and keep testing and testing and testing. I thought it was clean, now it's not. I thought it was clean, now it's not. You're using the best available treatment technology to get it all out. And that they have the ability to do that. They don't know, their brain isn't there. They're in their mindset of, I got a chemical, I set a standard. I got a chemical, I set a standard. That takes years and years and years and years. And we all know. So we got to help them along. We got to tell them how important it is. We got to tell them that we need it now. We got to tell them what they can do. You know what I mean? Not what you can't do, but what you can do and what you can do to show up. And then what you need to work towards, which is drinking water with no PFAS.
I would just like to add something. Those were excellent points. I agree. And I also do want to reiterate that New York is not the bad guy here. They are really trying to do their best. Part of the problem is this: they have to be concerned about cost. So imagine if the state of New York or any state said, okay, we're going to have a 1 part per trillion drinking water standard for all PFAS. Who has to pay to clean the drinking water? That burden is shifted to the municipalities. So whenever these environmental regulations are made, you have to take into account not just technology, but also cost. So here, there are many, many municipalities that just simply cannot afford to put up a filtration plant to filter their water. In my town here in Massachusetts, our drinking water, we have a 20 part per trillion for 6 PFAS standard. Our water was over that. It was 22 parts per trillion. My town of 23,000 people had to pay for a $9 million filtration plant. And so that's expensive. Not all towns can afford that. So New York is trying to do the best it can. We really have to shift that burden away from the municipalities and put it on the companies that have caused this problem in the first place, which is why there are a number of class action lawsuits against DuPont, 3M, Chemours, all of these companies. They're the ones that should be paying for it, not the municipalities. So New York is concerned about your tax dollars, and that's a good thing, in my opinion, but we really need to go after the companies that caused the problem in the first place.
Yeah, so let me chime in on that. I mean, one thing I want to say is that, you know, CCE and NRDC, we've worked with water suppliers from around the state, both the AWWA, the American Water Works, the New York State Rural Water Association, to collaboratively work to get grants to water districts around the state to pay for this technology for both PFAS and 1,4-dioxane. And so we've teamed up because exactly what Kyla said, you know, look, we want clean water, but, you know, environmental groups, including myself, advocate for clean water and affordable water. But in order to do that, you know, we need funding for this technology so it's not falling on the ratepayer and the water payer. And it's been very successful. I have to say the work and the collaboration has literally paid off. There's been a lot of grants that have been allocated to water districts around the state so they can afford to get this expensive technology. I mean, last I checked, and it could be more now with, you know, inflation and supply chain, but the granulated carbon filtration systems that are needed for PFAS filtration are about roughly $1 million per drinking water wellhead, plus the maintenance cost. So it is a big cost, and that's a very fair point, and I appreciate you raising it. All right, I see there's one person with a hand up. Normally we don't call on hand up, folks. We just want you to put your comment in the chat, but since it's Amanda Fields, who I've known a long time, Amanda, just unmute yourself and ask your question.
Okay, thank you. I am a commissioner of water. I'm also, I don't usually say this, but I just want you to know the perspective I'm coming from. I'm a cancer survivor. That is how I got into this. I was not in the public sector and decided to look into environmental issues. And here I sit as a water supplier. You had mentioned that New York is not in line with the other states, Miriam. And I just wanted to ask, with the proposed MCLs, are there any other states that do have proposed lower numbers? Because I'm going to help, you know, advocate and bridge the gap and kind of come to, you know, speak to Department of Health, which, you know, Adrienne, I've been with her, and, you know, we want to try to get this together. And it you know, it is difficult when, you know, you don't have the testing and availability, and, you know, we want to do everything we can. So that's kind of the perspective I'm coming from. Are there any other states that are proposing these MCLs that are lower? Because New York kind of has led the way. And you had mentioned that.
So there are states that have lower levels for individual ones and for combined. And, you know, they're not everyone's as low as we were asking for here. New York really would would blaze ahead if it were to set them, you know, at the detection level, which is what people are really clamoring for. But we do have, I mean, what Dr. Ben just mentioned, which is in terms of where Massachusetts is in terms of a combined one, is lower than what New York is proposing. There are other states. There's a report that was just put out that compares all the different states, which sounds like it might be useful to you. I'll try to put it in the chat. If not, we can get it into the.
It was presented on May 3rd when the state, when New York State made their presentation, and they did compare all the states, their notification levels, their MCLs, and I didn't see that anything was lower than New York, but I could have missed it. So that's why I was asking, because it's important to advocate.
It was an independent report that was put out. I'll put the link in the chat. So that there are states with lower individual ones and lower and lower combined ones, which is really important. The combined ones being really, really important. It is incredibly, incredibly rare that the only time I've ever seen one of these PFAS chemicals in a drinking water sample is when somebody only tested for one. If you test for some of my colleagues did, started using some of the more expanded testing technologies, the more you test for, the more you find. And so the combined MCLs are incredibly important, and we need them really, really low. Our bodies do not distinguish between these different individual PFAS. It's not like, oh, no, I only have one, right? These are, they're added. We don't even know if it's additive or multiplicative in terms of how these many chemicals act together on the body. And so this is why everyone's really focused on the PFAS as a class, going upstream, making sure that you have pre-treatment standards if you're a wastewater treatment, so that you're not letting PFAS contaminated stuff come into your system, right? This is a way how you shift the costs away from the municipalities, right? The industry that's discharging that PFAS contamination into those systems, it needs to stop. And so there's a whole set of different spaces of moving upstream, and we need to make sure that we're talking about multiple. So Massachusetts, it's one that has a combined MCL of 20.
Right. I was talking not about the combined, but the actual individual, because I think that's important that we are making sure that, I think they were recommending the lowest. And then
I'll put the link in the chat.
All right. And then, just the testing, because I know that, we have to test at half of what the recommended MCL is. And the testing has been, we're trying to get that to a better place. But right now, as Adrian said, it has been very difficult in terms of getting, certified labs to test so low. So, all right. Well, thank you so much. I appreciate it. Adrian, thank you for letting me speak. And
thank you.
It's also important to note that, as Miriam said earlier, that once EPA comes out with their MCLs for PFOA, PFOS, and Gen X, every state is going to have to be at least that. That's the highest you can be. So even if New York keeps 10 parts per trillion for PFOA and PFOS, hopefully EPA's MCL is going to be much lower. New York is going to have to come, but again, that's just 2. So honestly, because we can only test for 70 of these in commercial labs, right, about 70 right now, we really need to shift to a total organic fluorine test, which will tell you the universe of PFAS without a targeted analysis of what each PFAS is.
100% agree.
Well, New York wants to continue to be the leader, so.
Yes, and we'll see if EPA really does come out with their numbers by the end of the year. It'll be quite the holiday gift from EPA to come out with a drinking water standard for these chemicals. I'm not sure it's going to happen, but we'll see if it does happen. So Legislator Richburg is asking, what type of testing machines will we need? You should call me, Legislator, because I worked really hard to get Suffolk County a grant from New York State to be able to test. Suffolk County is a fabulous water testing laboratory. And you really could get a grant from New York State to do it, but the health department has to write a letter saying they want the grant. So we should talk offline about that. All right. I think we're at the end here. It is 12:56 and Carla put the maps on there. Thank you. Everyone, please write to our New York State Health Commissioner. And we put up some great talking points. I hope that this was very informative for you, and also something that you feel, empowered to change. We're doing well in New York. Again, don't get me wrong, but we need to do better, and we expect better. We can do better. And this forum is designed to have your voice make a difference. So thank you so much, everybody. We appreciate your time. Thank you, Dr. Bennett. Thank you, Miriam. I really appreciate your terrific input and your valuable knowledge being shared. Thank you. Bye, everybody.